Hello everyone. I am Liz Bryan, a psychiatric nurse practitioner and a Doctor of Nursing Practice student. I am excited to present my project on substance use disorder and how exercise can help. Thank you so much for being here. Committee members, Chairperson, Dr. Jastak, second reader, Dr. Snell, community person, Dr. Anthony. Can exercise support individuals on their journey to recovery from addiction? Background. Substance use disorders are a significant public health concern, with increasing prevalence affecting different populations. Substance use disorders are described as an inability to control the persistent use of drugs, despite experiencing negative consequences. Addressing SADS is vital for public health due to their impact, which includes health consequences, physical, mental, and social implications of prolonged substance use. Economic burden, the costs related to healthcare, lost productivity, and legal issues. Need for effective interventions. There is an urgent need for innovative and effective treatment options. The role of exercise in recovery. There are numerous studies that demonstrate that exercise can serve as a beneficial intervention for individuals recovering from substance abuse. Mechanisms. Exercise increases endorphin levels, enhancing mood and reducing cravings. It offers a structured routine that can occupy the time previously spent using substances. Exercise builds resilience and develops coping strategies. Significance of the project. The project aims to raise awareness about the opioid epidemic and its significant impact on communities. It focuses on providing support and resources for individuals dealing with substance use disorders, while emphasizing the need for proactive prevention and intervention strategies to fight rising overdose deaths. Collaboration with healthcare providers, policymakers, and community organizations is essential to create a stigma-free environment that encourages open discussions about substance use. The project goals includes educating the community on the risk of opioid use, recognizing the signs of substance use disorders, and promoting available treatment and recovery resources. Additionally, the project seeks to identify gaps in current services and recommends practical solutions to enhance support systems. Ultimately, the initiative aims to contribute to research that deepens understanding of the opioid crisis and its implications for public health and safety, fostering positive change for affected individuals and families. Moreover, to bring awareness to the positive effects of exercise. Review of the literature. The review includes 10 primary research articles emphasizing the efficacy of adjunctive exercise interventions for individuals diagnosed with substance use disorders. The review identifies 4 principal themes. First, the prevalence of substance use disorders. Second, the impact of self-perceived health benefits. Third, barriers to treatment. Fourth, harm reduction strategies. The objective of the literature review is to enhance awareness regarding the essential interventions required for clients struggling with substance abuse. Furthermore, it establishes a vital link between substance use disorders and the potential benefits associated with adjunctive exercise. These themes have significantly contributed to the foundation of the project and have played a crucial role in promoting awareness of necessary interventions to support individuals diagnosed with substance abuse. The integrated literature review seeks to clarify the relationship between substance use and the advantages of exercise. Providing an efficient understanding of this topic is vital. The knowledge acquired through this review has fostered sustainability in increasing the needs of individuals affected by substance abuse within the community. The findings from the review highlighted the urgent need for accessible solutions to fight substance use disorders in support of the DMP project. Substance abuse disorders represent a substantial public health concern on a global scale, resulting in multiple adverse consequences. These disorders frequently occur or co-occur with mental health issues or comorbidities such as depression and anxiety, which further complicate the risk factors associated with substance abuse. The project uses the theoretical framework of the COM-B model and its impact on substance abuse disorders and exercise benefits. The COM-B model, which stands for capability, opportunity, motivation, and behavior, is essential for understanding and addressing substance use disorders, as well as the benefits of physical exercise. Capability, the model emphasizes that an individual's capability is vital for achieving desired behavioral changes. When addressing SADS, it is important to assess whether individuals possess the necessary skills and knowledge to adopt healthier behaviors or engage in exercise that promotes recovery. Projects targeting substance use disorders can incorporate training sessions aimed at enhancing participants' capabilities, equipping them with the tools needed for positive change. Opportunity. The COM model highlights the significance of external factors that can facilitate or impede behavior change. In the context of substance use disorders, creating environments that provide access to support services, peer groups, and healthy activities is essential for encouraging recovery. collaboration with local organizations can ensure that participants have ample opportunities to engage with these supportive resources. Motivation is a crucial component for sustaining behavior change. The COMBI model acknowledges the importance of both intrinsic and extrinsic motivators. In projects focused on substance use disorder, strategies such as motivational interviewing and positive reinforcement can help individuals recognize the reasons for change, fostering greater engagement in project activities and related exercises. Utilizing the COMBI model in the development of initiatives addressing substance use disorders ensures that capability, opportunity, and motivation are effectively considered. This comprehensive approach enhances the effectiveness of interventions aimed at supporting individuals on their recovery journey. Methods and design. In the study, substance use disorder, the primary investigator utilizes a quantitative, exploratory, prospective design to investigate the effects of exercise on substance use disorders. The data was systematically collected and analyzed over 8 weeks, allowing for a clear understanding of the changes resulting from the intervention. 2 tools were utilized: the PHQ-9, which evaluates the severity of depression symptoms, and the Likert scales that was helpful gauging participants' perceptions of the impact of exercise on their drug cravings. This methodological approach was essential as it facilitated direct comparison and produced measurable outcomes. The alignment of scores from both assessment tools enhanced the data analysis and provided a comprehensive perspective on the effectiveness of the intervention. Sample using the project. The analysis of the study sample and the results was conducted, as mentioned, with descriptive statistics, which facilitated a clear synthesis and interpretation. Demographic data. A convenient sampling method was used to select participants. The study included a total of 10 individuals diagnosed with substance use disorders. The participant group consisted of an equal representation of genders, with 5 males and 5 females. Racial and ethnic diversity within the sample included 3 Caucasians, 3 Black individuals, 2 Hispanic individuals, and 2 individuals of Indian descent. The ages of the individuals were within 30 to 41 years old. The data collection was carried out utilizing standardized methods to ensure consistency and reliability in gathering information. Data analysis. Data analysis and statistical methods purpose and evaluation. To evaluate the difference in pre- and post-intervention scores on the PHQ-9 depression scale as well as the Likert scale, as the Likert type ratings, the study applied the Wilcoxon sign rank test. This non-parametric test is particularly suited for comparing two related samples, making it an excellent choice for studies structured around pre- and post-intervention assessments. It identifies whether there are significant changes in depression levels and ratings without relying on the assumption of a normal data distribution, which enhances the robustness of the analysis. Results. The results of the Wilcoxon sign rank test indicate significant improvements in depression symptoms as assessed by the PHQ-9 questionnaire when comparing scores obtained prior to and following the intervention. These findings are consistent with the trends observed in the Likert scales, emphasizing the effectiveness of the intervention in alleviating depressive symptoms among participants. Results. Test statistics. The analysis revealed a post-intervention PHQ-9 score compared to a pre-intervention of -2 to 0.836 with an asymptotic significance of two-tailed of 0.007. These findings suggest that participants experience statistically significant improvements in their mood after the intervention. Furthermore, a closer look at the Likert scores reinforced these results, indicating notable enhancements in the overall psychological well-being of participants as a direct outcome of the intervention. Limitations. The findings of this study may not be broadly applicable due to the limited sample size. Potential biases may exist in the data collection methods or participant selection, which could impact the results. Time constraints may have hindered the comprehensiveness of the research and subsequent analysis conducted. Moreover, personal interpretations and subjectivity may have influenced the analysis and shaped the conclusions drawn from the data. Discussion. How do the results relate to the impact? The findings related to a targeted intervention that prioritized exercise as a mechanism to enhance mental health outcomes among participants with substance use disorders. A significant reduction in depressive symptoms was observed, as indicated by the post-intervention scores on the PHQ-9 assessment. Results from the Likert scale evaluations corroborated the effectiveness of integrating exercise into treatment plans. These findings highlight the essential role of ongoing intervention strategies in promoting successful recovery outcomes. Implications for practice. The integration of structured exercise programs within treatment plans is essential for fostering recovery and enhancing overall well-being. Holistic strategies. It is imperative to develop comprehensive approaches that concurrently address both physical and mental health needs through tailored treatment plans. Interdisciplinary collaboration. The engagement of multiple disciplines can significantly enrich treatment strategies and facilitate the provision of comprehensive care. Client involvement. Actively involving clients in the formulation of their treatment plans, particularly with regard to physical activities, can substantially enhance their commitment to the recovery process. The integration of these elements can result in more effective treatment outcomes and an improvement quality of life for clients. Conclusions. The study highlights the integration of evidence-based practice in treating substance use disorders. The study underscores the essential role of mental health in the recovery journey from substance use disorder. It demonstrates that engaging in structured activities such as regular walking can significantly reduce both depressive symptoms and cravings, ultimately leading to a more comprehensive recovery experience. The findings strongly advocates for increased funding for exercise programs, positioning these initiatives as essential components of treatment that can enhance the recovery process for individuals struggling with substance use disorders. Furthermore, the study recommends promoting physical activities as a core element of the recovery framework. It suggests establishing partnerships with local fitness centers to create accessible and supportive environments for clients. The research illustrates a commitment to improving recovery outcomes for those struggling with substance use disorders by implementing innovative treatment strategies. These strategies aim to ensure that each individual receives holistic support tailored to their unique needs. Additionally, the program prepares Doctor of Nursing practice graduates to effectively take a leadership roles, enhancing the quality of client care and promoting the adoption of evidence-based practice across various healthcare settings. The DNP program ultimately contributes to the overall advancement of the field. Here are some references and this concludes the presentation, and thank you so much for taking the time to listening and watching my presentation. Thank you.